Hi, I'm Dr. Anna Wilson.
And I'm Dr. Rita Garabet, and today we're doing something really fun and unique. We are going to review celebrity smile makeovers. Now, this is our genuine reaction on camera as we've never seen the before and afters of the celebrities we're about to review. Okay, so this is Jennifer Gardner.
The first thing that I'm noticing, she definitely had some kind of lip repositioning procedure, that either being Botox or surgical repositioning, possibly ortho.
I was gonna say, I feel like it's hard to say. I feel like she had, so in this photo, her before photo, this is what I was referencing with the facial thirds. I feel like her lower facial third is definitely larger than the other 2/3 of the forehead and the mid-face. So there is a potential for orthodontic surgery here, but I don't see it. She could have had it done. And this is something that orthodontic surgery or repositioning of the upper and or lower jaws would help. I mean, she could have had it because if you pay very close attention, I don't know if that's like natural progression of age, if she had chin filler, but if you look very closely at her before photo, her chin is a lot sharper. And I'm sure if we had a profile shot, the facial profile shot, if it's like convex versus overly concave, that would tell us a lot and we'd be able to really determine whether or not orthodontic surgery was completed. Yes. But that's usually one of the more invasive fixes, but one of also the most effective fixes for that lower face discrepancy. Another thing she could have just done, which we do all the time, is a gum lift and Botox and filler.
I don't think she has veneers.
I think she could have gotten him on the two centrals, maybe. The two centrals. It's hard to say.
Ed and I look very, very similar to her before.
That's true.
I think the lip repositioning did some huge makeover to her, and then zoom widening for sure.
Zoom widening for
100%.
Yeah. So I think she probably was an orthodontic candidate.
I think so too.
It's amazing what the power of surgery can do. It's not all just teeth. We gotta look at those facial thirds, and it's so important.
You know, I love it, Rita, because you think about everything like overall. Like we don't just look at one tooth problem. Oh, this tooth is out of alignment, let's fix it. Or like, let's do a crown. Like, no, we gotta treat everything and we gotta give the patients all the options.
Yeah.
And then we can navigate from there.
Yeah, well, teeth really help make a person, but in order to like help make the person, you gotta look at the person overall, right? You can't just treatment plan based on one sole issue. We gotta really look at them as a whole and what are they trying to tell us? And I think in this case, she probably disliked that gummy smile. A lot of people don't like that about themselves, unfortunately. And yes, it's a little bit more of an intervention thing, but when you do orthodontic surgery, very similar to when we do full mouth rehabs, it helps so much. They breathe better, they eat better, they function better. They look better, they age a little bit slower because they're not having to strain their muscles a lot, less pain. There's just so many things that dentistry, full mouth rehabilitation, and frankly, orthodontic surgery can fix.
That is so true. Well, this was very fun, Dr. Rita. I love critiquing these cases with you.
Yeah, I loved hearing your expert opinion. It's really amazing how like we can come together as a team and see what our differences of opinions are and like what really was done. We really are a great duo. If you liked this content, thank you so much for the support. We would appreciate even more support by liking, commenting, subscribing, finding us on all social media avenues, and we look forward to hopefully seeing you there.